Welcome to Teaming, Collaborating, and Engaging with Families of Children who have special needs. In this content talk, you will be thinking about why teaming is important, the roles of the different consultants or itinerant teachers and therapists, and also you will be thinking about examples of family-centered practices. Special education and related services are provided by a team. The team consists of family members and professionals who work together to plan and implement a child's educational program. Families are always considered part of the team. Infants and young children, especially those with multiple disabilities, need the services of individuals with expertise in various disciplines. The importance of team participation is included in relevant laws such as IDEA and Head Start, and teaming is considered a recommended practice by the DEC. Traditionally, we talk about three approaches to teaming. Multidisciplinary teams involve professionals from the various disciplines, but they do their work, planning, treating, teaching separately. The child and family may benefit from the expertise of the varied professional disciplines, but the disadvantage is that there is little sharing or information across the team members, little joint planning, and the burden of integrating the information falls to the family. Interdisciplinary teams also involve the expertise of varied professionals. Professionals usually come together to share information and develop a joint plan. The plan is generally implemented by the individual from the specific area of expertise, such as the physical therapist implements parts of the plan related to motor development and learning. A potential disadvantage of the interdisciplinary model is that there is sometimes a lack of communication in between formal meetings of the team. The transdisciplinary model of teaming is a newer model. In this model, the team members meet together and develop a joint plan. They also practice role release so that each member of the team is learning from each other. Not every member of the team needs to see the child, but can provide support to a primary service provider who integrates the information and practices of all the team members. The strength of the transdisciplinary model is that the treatment plan is truly integrated and all are working towards shared goals. The disadvantage is that this model requires ongoing communication and collaboration to be successful. Here are some individuals who may be on the team: speech pathologist, physical therapist, occupational therapist, an early childhood teacher, an early childhood special education teacher, a social worker, a nurse. You have read or heard about, in some cases, that individuals from various professions come in and help. Think about the role of each of these people. Some professions may be missing, such as a nutritionist or a behavioral or mental health specialist. Effective teaming requires collaboration. Collaboration is more than individuals working together. It is the process through which individuals with different areas of expertise, knowledge, experiences, and perspectives meet and work together as a team on a consistent basis. Think about identifying the expertise, knowledge, experiences, and perspectives of the parents or other family members as a way to emphasize the important role that families have in the team. Teaming and collaboration are fundamental beliefs and values in early intervention and early childhood special education. In order for teaming and collaboration to work, these elements must be present in both policies and in practices. Think about how you have used experiences as a member of a team, and think about the elements of collaboration that you have experienced. Think about perhaps how the more you met, either in person or virtually, with family members and other team members, you got to know one another and you more naturally just felt like a team. Perhaps you recognize how respect and trust grew over time as you got to know one another and as you listened and supported each other's viewpoints. Having effective communication, such as really actively listening, is important as talking. Some people need to learn how to listen in order to demonstrate effective communication. Inclusion means that children with disabilities and other special needs are enrolled in community-based early childhood programs such as child care, Head Start, state-funded pre-K, and private preschools. The lead teacher most likely has preparation in general early education. A special kind of collaboration needs to occur as this teacher interacts with other team members, especially the itinerant or consulting teacher, therapists, or specialists. These individuals go by a variety of names. Itinerants or consultants visit children and their teachers on a regular basis and have a responsibility to address the goals and objectives found on the child's individual education program. These individuals may address their responsibilities in varied ways. One way is to provide direct services to the child, but this means that the child probably gets the special service only when the specialist visits. There may be little in-between time of learning and practice. Another way to provide service is to support the classroom teacher so that she or he learns the teaching plan and can implement the strategies when the specialist is not there. This obviously requires time and the other elements from the previous slide, such as respect, effective communication, and collaboration. It also requires that the specialist can model and describe the intervention in a way that the teacher understands and sees it as a natural part of the classroom. Some specialists use written plans, photos, and videos to support teachers in between visits. Engaging with families is essential to the success of early intervention and early childhood special education. Family engagement and family-centered practice are fundamental values and recommended practices. Here are some key assertions based on both research and values. Human relationships and the effects of relationships are the building blocks of healthy development. Development and learning take place within the context of relationships. Important relationships include those between the child and the parent or family, the child and other caregivers, the teacher and caregiver, and family, and among the children in the group. Pause the video now and take a look at parent reactions. This video is embedded into the Blackboard site. Receiving the news that your family has, or that your child, has a developmental delay or disability can result in many emotions. Families can feel stressed, isolated, relieved, devastated, anxious, angry, frustrated, any of these combinations. Several quotes are here on this slide are from families who have recently learned about the diagnosis of a child. Needs, reactions, emotions change over the lifespan as families cope and adapt, and as their child learns, grows, and transitions to new environments. Families report the following emotions. At some point, there is relief. Someone else has corroborated parental concerns. Parents often have concerns about their child's development well before they can get a diagnosis. Their child's behavior is explained. A diagnosis allows access to services that they weren't available before, so families do get that relief. Families can enroll in Part C services and begin intervention and access. Sometimes there's a feeling of lost time. Parents often discuss losing the window of opportunity if they receive a diagnosis later or if they miss key early intervention years. Pressure to locate and begin services. It can take a long time to get into certain programs, and parents may feel frustrated that they could not start the process earlier. There's sadness at the loss of time that is valued and cannot be recaptured. Sometimes families feel guilt as a cause of an event, even though there is not much medical evidence linking specific parental behavior to disabilities. Many parents, or mothers in particular, blame themselves and feel as if they've done something to cause whatever it may be. Anger. Parents may search for explanations and meaning and feed anger that has happened to their family. Some families grapple with the unfairness of the situation and why their child has a disability while so many other children do not. Then there's grief, which is the loss of the child that has been planned for. Worry about the future and unknown. After learning that their child has been diagnosed with a disability or a delay, families need information. Information about the disability and how it relates to their child will be helpful. They need to know how this disability can impact their child's development and day-to-day life. They also need resources. Families need to know what resources and services are available in their area, how to access resources and services. They also need to know skills to assist themselves in assimilating to having a child with special needs. Finally, they need social supports. Parent-to-parent programs exist in many communities throughout organizations, and these can be available to support parents in parental support groups, which are offered in many special education centers. They may also need support with advocating for their child's access and inclusion in certain programs, advocating for certain services such as speech services, for example, or helping to deal with their insurance company. These are important supports that families may need. Finally, families may also just need someone to listen to their concerns. Ultimately, we know that education and the well-being of children is related to parents' understanding and skill at advocating for their child with special needs. Each family we serve will react differently to a diagnosis. Many families report feeling stressed about parent-child interactions, attachment, sibling relationships, marital stress, severity of symptoms, and behavioral challenges. Many families also report a sense of loss, confusion, financial hardships, disruption in family routines, sense of alienation, and social isolation. Parents may feel a lack of confidence in their parenting skills. They may feel shame that they are uncertain of how to support their child. Certain characteristics of disabilities, autism in particular, can be especially challenging, with challenging behaviors, delayed communication, which causes great stress to families and can have an impact on family interactions, routines, and the functioning of the family. Families often need, request, and benefit from coaching, support, and skill development in these areas to help their children learn new skills, help the families address challenges, and adjust to living with a child who has special needs. It can help families regain feelings of confidence in parenting and problem solving. Not only is it important to prescribe a plan, but to include families in the development of plans and problem solving, identification of problems, selection of skills and priorities, selections of strategies to use, and effective use of strategies. They will be a child's long-term teacher, and so we need to help share strategies with families and bring in other families to support one another. Throughout the 1990s and even today, Dunst, Johnson, Trivett, and Hamby have given us some research and understanding about family-centered practices. Family-centered practice is a way of engaging with families or partnering with families. It is associated with family satisfaction, with services and supports, and it is associated with increased parental self-efficacy and perceived positive outcomes for children and families. There are a number of family-centered practices. There's an emphasis on strengths rather than deficits of both the child and the family. We promote family choice and control over desired resources that we are wanting to suggest. And that's through the development of a collaborative relationship between parents and professionals that enables family-centered practice. More recently, researchers have looked at everyday family-centered practices that are relational to those that are participatory. Relational practices are those interpersonal behaviors such as warmth, active listening, empathy, authenticity. Participatory practices are those with more action-oriented. Things like professionals sharing information, professionals encouraging parents to make their own decisions, supporting their own decisions. Professionals encourage parents to use their own knowledge and experience, and professionals help parents learn new skills. Both relational practices and participatory practices are important, but being warm and caring is not sufficient. It is the participatory practices that add value in terms of family perceptions and family outcomes. In other words, we want to be warm, empathetic, and caring as we are bringing specific actions to the table for families to become involved in and take on themselves. In conclusion, we have learned throughout this course that inclusion is essential in creating an inclusive early childhood classroom to help support all learners, not just children with developmental delays or disabilities, but our dual language learners and other children who are diverse learners. We've also looked at evidence-based and recommended practices. We've looked at the difference between IEPs and IFSPs. We've discussed curriculum accommodations. This should say accommodations here. We have thought together about embedded teaching and ongoing child assessment, and of course, children and families.